This is a model of the right knee. I know it's the right because if I look down here at the tibia and the fibula, I see that the fibula is on my left, but this person's right side, and therefore it is the more lateral bone, and so this must therefore be a right knee. Okay, let's begin. This up here is representing the quadriceps tendon, so all four of the quads would ultimately be attached to this tendon right here. The patella we can see right here. It's actually embedded within this connective tissue structure, and from the patella to the tibial tuberosity here, this is the patellar ligament. And so you guys have surely played with this ligament before. You have tapped this to induce a knee jerk response. Okay, if we move the patella and the quadriceps tendon and patellar ligament out of the way, we can see some additional connective tissue structures of the knee. First of all, we can see that there are two ligaments on either side, the lateral and medial side of the knee joint. These are there to prevent the tibia from swinging to the left and to the right. They are called collateral ligaments. Specifically, the tibia is the medial bone, and so this here must be the medial collateral ligament. The fibula is the lateral bone, and so this must be the lateral collateral ligament. Okay. Within the joint capsule itself, within the knee itself, we can see these structures right here. This is a meniscus, so a medial meniscus and a lateral meniscus, and we can see this even better if we bend the knee. All right, note that these are fibrocartilage discs. They are roughly shaped kind of like a C. All right, so again here, it's shaped like a C, so very similar to the meniscus that you would see in a test tube. Okay. Also, we can see this other ligament in here. This is the anterior cruciate ligament. Note that it is going to attach to the anterior surface of the tibia, kind of cross back diagonally to attach to the posterior of the femur. Now, if there is an anterior, there's most likely going to be a posterior. To see the posterior, let us flip the model to the back. What we can see on the posterior side are the two condyles. Right, from some perspective, here's the fibula, that's the lateral side, so this must be the lateral condyle. Tibia is on the medial side, so the medial condyle, medial collateral ligament, lateral collateral ligament. We can see just a teeny bit of the ACL, the anterior cruciate ligament right here that we saw from the front. But what I want to point out now is this right here. This is the posterior cruciate ligament, or PCL. And so the PCL essentially prevents the tibia and the fibula from essentially being displaced posteriorly. And the anterior cruciate ligament, right, is going to prevent the tibia and the fibula from being displaced anteriorly. Okay, so ACL prevents this movement, PCL prevents this movement relative to the femur up here. And again, we talked about this before, but the medial collateral ligament is going to prevent the tibia and fibula from being displaced in this direction. The lateral collateral ligament is going to prevent the tibia and the fibula from being displaced medially.